Assisted living residents are encouraged to prepare for August licensing changes. With Minnesota's new assisted living licensure law set to take effect on August 1st, the Minnesota Department of Health encourages families and residents at assisted living type facilities to ask their current care providers about their plans and any impacts to care provided beginning in August. Assisted living providers will also need to notify families and residents if they will no longer provide certain services or if contracts are updated to meet licensing changes. Approximately 60,000 Minnesotans live in 1,800 assisted living type facilities that mostly serve senior citizens. Most of those who live in assisted living type facilities, dementia care, or housing with home care will not experience significant changes in their services due to the new licensing program. However, some residents may see changes by this August, and in some cases, those changes may make it necessary for residents to find a new service provider or even a new place to live. According to Minnesota Commissioner of Health, Jan Malcolm, the best approach for residents and their families to connect with care providers as soon as possible to learn how the new licensure program may impact the provider's services and plans going forward for the resident. Commissioner Jan Malcolm commented that it is an important time now to discuss your care because providers are currently making decisions about the type of services they will be offering beginning August 1st. We are working with providers to make sure that residents get all the information that they need in a timely manner, but it's a good idea for residents and families to have these discussions with providers and ask questions now so that they are prepared to manage any new possible changes. Minnesotans who live in assisted living type facilities should look for a notification from their provider in the coming weeks. Or they should contact their provider to learn about whether their provider intends to get the assisted living license needed to keep operating past August 1st. Current assisted living type providers must apply by June 1st to be eligible for Minnesota's new assisted living license. The new license structure protects the foundation of assisted living here in Minnesota, including consumer choice, independence, and the ability to age in place while enhancing transparency and regulatory accountability. We encourage patience through this generational change, giving caregivers, regulators, families, and residents time to adapt and complete the significant transition. This comment was made by Gail Kenvold, who's the president and CEO of the Leading Age Minnesota Foundation. Any comprehensive home care provider not planning to provide home care services after August 1st must give a written notice by May 31st to every resident who receives services. Likewise, a housing with service provider who does not intend to continue services after August 1st must notify tenants in writing by May 31st. No one contemplated that we would be crafting the rules for this new framework in the middle of a pandemic, which has made this transition more complex. This was mentioned by Patty Cullen, President and CEO of Care Providers of Minnesota. Despite all the challenges of the COVID-19 pandemic and a work shortage, we remain fully committed to successful implementation of the new assisted living rules in our communities. These changes could impact residents living in housing with home care services, which may affect the following services: assisting with dressing, self-feeding, oral hygiene, hair care, grooming, toiletry, and bathing; providing standby assistance, medication management services, hands-on assistance with transfers and mobility, treatments, and therapies. This groundbreaking reform legislation passed by the Minnesota legislature and signed into law by Governor Tim Walz in 2019 is designed to improve the safety and quality of care in long-term care in Minnesota. There will be 2 types of assisted living licenses beginning on August 1st. The first is the assisted living license, and the second is the assisted living license with dementia care. The 2 licenses will replace the comprehensive home care license and the housing with services regulation, which will be discontinued after July 31st. The Alzheimer's Association is always available to support families as they consider any change in care for someone living with dementia. Sue Perriott, the Alzheimer's Association Minnesota of North Dakota chapter and CEO, made this comment, saying that we also understand that these transitions may be stressful, but we believe that the new licensing system will provide a more stable and safe care environment for residents in all assisted living settings. The new assisted living reforms are setting higher expectations for providers, and they create more protections for people living in assisted living establishments. It will also create clear pathways for accountability and better services for residents of assisted living facilities. We want Minnesota families and residents to be aware of the positive changes that are related to the licensing of assisted living facilities. Christine Sundberg, Executive Director of Elder Voice and Family Advocates, made the comment, saying that we now have a substantial improvement in our safety and care standards and added protections on the way that we will keep our parents and spouses better protected from neglect and harm.